All right, so we ready? All right, so the GI system. So drugs dealing with the GI system. So what are we going to deal with?
X-lax.
X-lax? In general, what are the big things with the GI system that we need to worry about?
Ulcers.
Okay, so
Stool softeners.
overproduction, stool softeners. Okay. Okay. Good. Yep. Oh, we kind of skipped through a couple things, huh? All right. So yeah, so things we'll talk about, right? So peptic ulcers, okay. Constipation, diarrhea, emesis, which means what?
Vomiting.
Vomiting. Okay. And then aids to increase digestion of things. All right. So peptic ulcers. What's a peptic ulcer?
It's a hole in your stomach.
Yeah. So basically, what's the normal protection of the stomach? What normally happens? How's the whole thing work, right? Because it's a very acidic environment. So how come the acid just doesn't dissolve and break the stomach down to begin with? What's the protective mechanism there?
Some kind of special material made bicarbonate. I don't know.
No, actually, there's goblet cells that produce mucus, and that mucus basically is a barrier between the cells and the contents. So if something breaks down that mucus or causes that mucus to not be produced as much, then disease occurs. Okay? So basically, a couple things. So this is a balance. So with peptic ulcers, basically, we have things that increase the acidity. Okay, so certainly we take those, right? So basically, if you drink soda, right, that is a very low pH. You drink things that contain acid, orange juice, those things contain additional acid, so we can increase that. And then we have to balance that against the body's protective mechanisms, right? So basically, factors increasing acidity, or basically increasing stress, right? H. pylori. H. pylori. What?
Is that
Hydrogen.
Color
It is.
Yeah.
Heliobacter.
E. coli?
Heliobacter pylori. Okay. What they figured out, because what's the old traditional way of thinking about peptic ulcers? What happens? What's the cause? Stress. Right. What they kind of started figuring out, now stress certainly plays a role, what they kind of started figuring out is that actually you can get an infection of your stomach. And actually what happens is that Heliobacter pylori actually kind of hides between the mucus and the cells. And when it gets there, it basically makes the mucus less effective. Okay? So having this, and this is one of the things that they kind of start looking for, actually, if they're pondering, yeah, so they kind of start looking for that. Okay? NSAIDs can increase this. Now, how do NSAIDs increase your damage to your stomach? Remember, because we kind of talked about the aspirin and the COX enzymes?
They decrease mucus production.
Through what mechanism?
Prostaglandins.
Prostaglandins, right? So they affect the prostaglandins. The prostaglandins provide a protective mechanism. Right? So NSAIDs basically decrease prostaglandin production.
So it's not like you're putting an acidic. I mean, you are putting an acidic because they're.
Right.
But I mean, it's just
right. So say for example, so you take aspirin, you have enteric-coated aspirin, which basically breaks down and doesn't dissolve until it gets further into the that has no effect upon aspirin's ability to cause damage. Right.
Okay.
Right.
It's because it's inhibiting the prostaglandin.
Right. Okay. So obviously, acidic agents are going to cause increase. So the more that you drink the acidity, the more damage that could potentially be done. Pepsin kind of breaks down. And then smoking and stress, basically, again, so basically smoking causes an increase in acid production, and then stress basically also kind of causes that increase as well too.
Does smoking cause increased acid production?
there's a chemical so one of the chemicals, nicotine, basically causes an increased production of
So
acids.
stress should like stimulate your sympathetic response.
Right.
And that would
It would
cause
decrease
decrease
GI
in
motility.
GI.
But it's motility, not acid.
Well, enzyme
But like
production.
parasympathetic increases like digestion. So wouldn't that be when you get more stomach acid because you're going to
Yeah.
start digesting foods?
Sympathetic should decrease the enzyme production too, like all of that crap. It
Right.
decreases
Well,
digestion.
But there's a so the parasympathetic increases motility, increases secretions and stuff, right? But what we're looking at here, so that part's true, but what we're looking at here is how that is affected, how that mucus is affected, right? So basically, if we're not providing that protection, we provide less protection, that leads to damage. So the smoking and the stress leads to, it affects the mucus. I don't know exactly how it does it, but basically,
Is it through like vasoconstriction? Maybe? I mean,
potentially. But yeah, but there's a mechanism there. There's a tie there. Right. So factors decreasing, right? So the more mucus production, that kind of makes sense. Buffers. What are buffers?
bicarbonate.
Yeah. Right. So basically, you take products that basically kind of change the pH. Okay. Obviously, more blood flow would be good, and then increase in prostaglandin production. Make sense? Okay. All right. So now here's your parietal cell, basically, so your cells. So here's a couple ways at which it's kind of a drawing. Y'all heard of a proton pump? Okay. That's basically this hydrogen potassium ATPase pump. So basically what happens is potassium enters the cell, hydrogen goes out of the cell. So but the proton pump inhibitors shut this thing down here. It's not really a pump, it's an enzyme. But basically that's kind of the mechanism. So that enzyme works by basically pulling in potassium and kicking out hydrogen. So out here is your stomach lumen. So more hydrogen goes out here, the lower the acidity out here, the greater the mucus production I got to have, and then I don't have that, basically leads to damage.
So that's why proton pump inhibitors just inhibit it from becoming more acidic.
Correct. Actually, that's how all of this stuff works.
Right.
Right? So it's just by what mechanism. All righty? So let's see here. Prostaglandins, right? Prostaglandins are good or bad?
Good.
Right. So if you look there, so there's a prostaglandin that causes this pump to decrease the effectiveness of the pump.
So yeah, it would decrease
Okay.
hydrogen, so
Right.
decrease acidity.
Right. Histamine, there are specific, right? So you typically think of histamine in allergic reactions, right? What do y'all remember what receptors that is?
Which one?
H1, right? So there's an H1 receptor. This is the H2 receptor. Okay? So you have some folks like cimetidine. Okay? So basically those they're antihistamines, but they are specific for H2. The cimetidine doesn't work as, if I'm remembering correctly, cimetidine doesn't work as well for dealing with environmental allergies because it's specific to kind of H2. Okay? So but that H2 receptor causes an increase in this proton pump. The muscarinic receptor, so there's acetylcholine. So just the muscarinic receptors causes this, and then gastrin basically also causes this to function.
So are H2 receptors specific to like
The stomach.
your stomach?
Mhm.
And H1 is more like your cerebral muscle?
H1's kind of more systemic. There's an H3 that's also in there. But yeah. Okay. All right, so those are basically how, kind of a quick drawing, and we'll kind of get into it. All righty? So the H2 receptor antagonists basically block that receptor site, right? So no effect on H1s. So y'all heard of the Tagamet, Zantac, Pepsid, right? Heard of all those. Lots of money in those. Okay. So that's basically kind of what it inhibits it. Obviously, PUD, GERD, and then aspirational pneumonia. A lot of times you actually see these given in the hospitals for folks that are on vents because they're trying to reduce gastric acid secretion. All right, proton pump inhibitors, right? So that's that hydrogen potassium pump. Basically, this, if you take those, so like Prevacid, those inhibit those. Basically, what it does is it locks up that proton pump, it locks up that enzyme, and basically the body's got to rebuild that enzyme in order for it to function again. The anticholinergics, right? Basically, right, so it affects that muscarinic receptor site. So basically it blocks that, and then you don't get the effects of it. And then the prostaglandin analog. So basically this is one that actually stimulates that prostaglandin receptor site. Right, because remember that is one that basically causes a negative effect, causes that proton pump to stop being as effective. PD, peptic ulcer disease. Antacids. Okay, so what are antacids?
Increase the pH.
Right, so kind of effective buffers, right? So what? So give me some examples. Tums, right? Yeah.
Male.
Yeah, Tums. What's the? Because that works a different way.
Rolaids.
Rolaids. Yeah. Alrighty. So basically, what these are basically buffers. What they do is they attach to calcium, magnesium, aluminum, and they basically kind of put a buffer in there with it. Okay. So these work to a point. However, these ions, electrolytes, basically then can create other problems. So if you take too many of these, so basically you take too much calcium, it actually, so certainly that buffer helps, but if you get enough calcium, that calcium kind of then starts generating that pump to work again. So when small quantities, they seem to be effective. In larger quantities, that's when you kind of start popping them all the time. You're working against yourself.
Because of your body's natural.
Well, just the way, because no, because basically just calcium is an active component of all the cells, and so basically like calcium in order for the muscles to contract, you got to have calcium. And there's other enzymes and things that these electrons function with, and so as you get more calcium, those enzymes are more effective. All right. Yeah. So now those kind of what you guys were talking about. So the Metamucil, the milk of magnesia, have some of those in there, but they also have different effects, and we're going to kind of go through and talk kind of about those. All right. So ones that are kind of quote unquote antibiotics. They have antibiotic properties. So they attack bacteria. All right. Bismuth, Pepto, okay, amoxicillin. Y'all kind of heard of some of those, right? So basically, those are geared at eliminating the Helicobacter pylori. For the longest time, that bismuth, they really didn't know why it worked. They knew it did work. They just weren't sure why. But that kind of made more sense once they kind of started figuring out that Helicobacter pylori. 80% of the folks that have ulcers have Helicobacter pylori. All right. Let's see. Stool formation. All right, so we're going to increase stool. So basically, folks that have constipation need kind of some additional help. So we can kind of help do this. So there's a couple ways to do this, right? So basically, we increase the water absorption in the colon. That increases basically the fecal mass. When you increase the fecal mass, that basically increases peristalsis and starts things moving. Okay. So let's see. So we have excessive absorption, not enough water, right? So we get constipation, hard, dehydrated stool. When you get hard, dehydrated stool, you get constipated. You strain. What happens if you strain? You cause a vagal maneuver. You stimulate the vagus nerve and can pass out, as one thing. You can rip and tear stuff, so you have hemorrhoids or other recent surgeries or other where you got basically sores or basically wounds that are healing. When you strain, you can rip and tear those.
Can you prolapse your rectum?
There are ways to do it. I guess you probably could. Let's see. All right, yeah. All right, so when we get to inadequate absorption, right, we leave the diarrhea. That make sense? All right, so here's a couple things. So laxative and the cathartic. Laxative basically kind of produces soft stool, basically gets slowly over a couple days. Will kind of increase the amount of water in there, okay? The cathartics, basically, we want it out now. So it depends on how quick they want things to function.
So would be the cathartic be more risk for hypovolemia versus laxative?
The cathartic is probably more of like for poison or overdose. We're like, let's get it out.
I mean, is that like in the same lines as like an enema? Or is that totally different?
No, because an enema, you're actually
Oh.
forcing fluid in there.
Targets would work that like for when you're gonna have colonoscopy or something
Yep.
like that, they're gonna get rid of colon lightning and all that, right?
Yep. All right. Laxatives have a couple different ways, and I think we talked about these. Yeah. So we'll go through these, but bulk forming, surfactants, stimulants, and osmotics. All right. Bulk forming, right? So Metamucil, okay. Citrusel, poly. Basically what you're doing is you're taking in fiber. Non-digestible fiber. Non-digestible fiber basically means you, one, give more food for bacteria. That bacteria then kind of have byproducts of their metabolism. They increase growth. And also that fiber then absorbs water. Okay? But this kind of keeps you, so folks take Metamucil to kind of make sure that they stay regular. So get a little teaspoon, put it in water, they drink the water, in it goes, and basically kind of keeps their system functioning normally. Okay. Let's see. The surfactants basically lower the surface tension, okay, on the stool, basically, which means it can penetrate the stool. Penetrates the stool, becomes bigger, things move along. Let's see. Stimulant laxatives basically stimulate peristalsis. Okay, so they have a direct stimulation on the peristaltic wave, increases it, kind of starts moving things along. It also affects.
More on the muscles of your gastric muscles, like to get everything going.
Right.
Like
Well,
stimulant.
but it's so it's a different. So the stimulant does that, but also basically affects hydration. So basically, it also has some properties that kind of basically pull water in there as well. Okay. Yeah. So y'all heard of those, like colorectal X-lax. Okay. Yeah. So it basically increases the peristaltic wave, kind of keeps things going. Okay. Osmotics. What are osmotics?
Cold water in.
Full water.
Yeah, right. So basically, these are large, non-digestible molecules that then attract water into the lumen. Okay. So milk of magnesia does that. Sorbitol, which we'll talk about here in a little bit, basically is another one that kind of does that as well.
So does fiber kind of act the same way? I mean, I was kind of listening to that, but like it's non-digestible, so doesn't like we eat fiber, we eat like food high in fiber, it
Yeah.
brings in.
I think where the difference is fiber is basically, so when you take fiber, so like broccoli, right? So it's very high in fiber. We don't necessarily digest it and absorb it, but it's a great source of food for the bacteria that's in your gut. And so the-
Good
Right.
bacteria.
Correct.
Okay.
Right. And so I think fiber kind of falls under that.
Okay.
Right. For these, they don't use those. All right. So antidiarrheal, basically, right? Now, nobody likes diarrhea, right? So, but what's the purpose? So when you have diarrhea, what's your body trying to do?
Void, whatever.
Right. So there's something toxic in there that it doesn't like, and it wants to get rid of it. If you take an antidiarrheal medication, what are you doing?
Stopping that.
You're keeping it in there longer, right? So what you kind of have to do is balance, can I be sick? How long can I be sick versus these other effects? Okay. So it's kind of like running a fever. A lot of folks go, oh, all fever is bad. No, you actually do want a little bit of a fever. You don't want to eliminate it entirely. When you want to eliminate the fever is when it basically is making you uncomfortable. Okay. Same process. So if you don't have the ability, so this is the biggest presentation of your life or whatever, okay. We can take some things and go. But, you know, hey, it's a normal day. We can kind of stay at home. Then that's, so those are the things you got to kind of balance. Okay. All right. But yeah, so anyway, there's a bunch of those stuff. All right, now vomiting. Okay. Vomiting, there's kind of two places in the body that has the vomiting. So we have the chemoreceptor trigger zone. Actually, we'll start here. So there's a vomiting center there. All righty? So the vomiting center basically has direct stimulation. So you stimulate the vomiting center, you vomit. The chemoreceptor trigger zone is an indirect process. When you stimulate the chemoreceptor trigger zone, it then tags and touches the vomiting center. So there's kind of two mechanisms by which we kind of work. All right? So you can see certain, right? So basically, if you get certain sensations, right? So you get an ear infection, it causes a sensation that you get that the world's spinning. You see certain things, you smell certain things, it just kind of immediately makes you sick. That works on the vomiting center. And that's a muscarinic, so acetylcholine is the neurotransmitter, and histamine, H1. So those are the receptors. Right? Here, basically, there's dopamine, the muscarinic, again, the acetylcholine, and then that's serotonin. Okay? So basically, if you kind of look, so bloodborne chemotherapy, opioid, ipecac, basically work on the chemoreceptor trigger zone. The stomach, small intestine, so basically if you take something in your stomach that your stomach doesn't agree with, it kicks it up here. Okay. So when we're dealing with vomiting, there's kind of two ways that we have to kind of look at. How do we do it? Most of the stuff that we work with kind of works here. Okay. All right. So the antiemetics, so serotonin antagonists, the dopamine antagonists, and the anticholinergic cannabinoids. What's a cannabinoid? Marijuana, yeah. All right. So Zofran, right? So it's a serotonin antagonist, right? Started out very much as a chemotherapeutic agent. So basically, we give you the chemotherapy. We kind of really anticipate that you're going to vomit. So here, a lot of the other narcotics, a lot of folks will go basically, if I'm going to give you this, there's a high risk that you're going to vomit. I'm just going to go ahead and give you Zofran and hopefully stop that stimulation. Okay. All righty. So other stuff that kind of works. So dopamine antagonists. So phenothiazines, butyrophenones. You heard of those before? What were they used for?
Like anti-anxiety and stuff like that.
Not so much anti-anxiety, but basically folks that have some psychological stresses, stimulations, yeah. So those work. Okay. And then cannabinoids, right? So THC is basically the active ingredient, but yeah, it's found in marijuana. They do have some non-marijuana stimulants that kind of basically work the same way. Okay. Digestion aids. So basically, if you get pancreatitis and your pancreas is no longer producing the enzymes that your body needs to break down the carbohydrates and the proteins and those, then they basically have things that they can give you that also stimulate those sites. So that's what these do. Make sense?